In our parenting support group, whenever we host a mother-to-mother get-together or a breastfeeding meet, we usually have parents attend it, we have grandparents attend it, but one of the first medical professionals to attend our support group meeting was Dr. Karthik Annamalai. He came for a baby-led weaning meet, and we got to know that he's a pediatrician, a neonatologist practicing in Coimbatore, and he told how he could learn a lot of things from that support group meet. Over the years, we bonded not only as my child's pediatrician, but also as a very active contributor in our support group, Coimbatore Parenting Network. He used to come for all our Introducing Solids meet to talk about the importance of baby-led weaning, where a baby can actually start eating by itself from 6 months itself. A lot of people do not know that babies can do that. So he supports baby-led weaning. He supports a lot of other unconventional methodologies in parenting, like using baby carriers or cloth diapers, or the parents itself doing infant massage, etc. So he's also somebody who supports extended long-term breastfeeding, and not a lot of medical professionals actually do that. Immediately when the baby is 1 or even 2, a lot of medical professionals say, okay, now you can stop, but Karthik is not like that. So I want you all to meet Dr. Karthik, get to hear from him how medical professionals need to keep themselves updated. They need to support a parent's journey. They need to support extended long-term physiological nursing or breastfeeding. So get to hear from Dr. Karthik himself about his journey being part of our parenting network.
I am Dr. Karthik Annamalai. I am a pediatrician, a neonatologist, and a pediatric allergy and asthma specialist. So I completed my studies, my higher studies in 2012, and I've been practicing in Coimbatore ever since for the last 10 years as a pediatrician and as a freelancing as a neonatologist. So back in medical school, in medical college, what I feel is we were taught more about illness and sickness. Like we would all be interested in probably saving a child. When a child is losing life, or we would want to do something that really makes a difference to a child's life. So the whole medical curriculum, at least the postgraduate medical curriculum, was focused more on treating a sick baby. So I was more confident in managing a child with dengue, with shock, with hypothermia, with jaundice. All that was easier to me. So I thought that is what pediatrics is going to be after I come out and practice. But then when I came into my private practice and I started practicing, the whole set of questions that haunted me were totally different, and I did not have answers to those. Like for example, most of the time there would be a parent who would come and tell me, see, my toddler is throwing a tantrum. What do I do? I had no idea. My medical school did not teach me how to handle a tantrum. Maybe in a part of psychology they said, okay, if a toddler throws tantrum, don't give in to the tantrum, time out. But I knew that time out was not the right thing to do because it didn't work with my child. So I did not have an answer to that mother's question, as well as I did not know what to do myself being a parent for my first child. So that made me think. And there was another incident which really actually made me feel so guilty that I had to search for an answer. So there was this mother who really wanted to breastfeed her baby, because that's what we've all been telling them. And again, in medical school we were taught breastfeeding is best, breast milk is best. So ask all mothers to give exclusive breastfeeding 6 months, continue breastfeeding till 2 years and beyond. When there was a problem in breastfeeding, what do we say? When there is a baby has weight loss, baby is not gaining weight, mother does not have milk, you supplement with formula. This is what I used to do when I was doing my residency. It doesn't mean that we used to promote formula, but when a mother genuinely had a low supply, we did not have an answer for that also. The only answer we had was give formula. So the same thing I told this mother. I was young then, I just started my practice. I gave her the best of my counseling. She was well informed. She was very much intended to breastfeed her baby. She went, but she always kept saying her supply was low. I counseled her how much ever I could about the diet, about the latch and all that. And then 1 week later, this baby came back with almost 20% weight loss. We discharged the baby with around 3 kilo weight, and the baby came back with almost 1.9 or 1.8 kilo. The baby was so dehydrated. We did a blood test, the sodium levels were sky high. Normal is 130 to 140, baby's sodium level was 200. So the baby was severely dehydrated because the supply was less, and the baby was probably getting dehydrated. So then we saved the baby, but that was different. Now again, while we are discharging, the mother has a low supply. I'm telling her, you give formula feed. She says no. She said, see, you only told me, the society tells me it is best to breastfeed your baby. I'm willing to breastfeed. Now suddenly when I tell you I don't have milk, you should give me a solution, you should not give me an alternative. So that really made sense. So, and she really felt guilty. That cry, she kept crying. Am I not fit? Why can't I breastfeed my baby? That guilt actually made me feel guilty, because it's actually not the mother who should feel guilty, it is us. She has a problem, she is willing to breastfeed, she's come to us with a problem, we don't have an answer. Why should that mother be guilty for that? So finally I didn't have an answer for that, and I could not sleep until I found an answer. So I kept searching. Obviously, to all the contacts that I knew in the medical field, doctors, obstetricians, pediatricians, neonatologists, everybody said no, tell the mother, give formula. But somehow I knew that mother is not going to give it. So I kept searching more and more for her, and that's when I stumbled upon this Facebook group called as Breastfeeding Support for Indian Mothers, BSIM. And the BSI became a member of that. I read their posts and it made sense. And that's when, to be very frank, I came to know that there are a group of professionals called as lactation consultant. Being a pediatrician, trained for more than 5 years in pediatrics, I did not know that we could seek help of a professional called as lactation consultant almost 10-12 years back. There were not many in Coimbatore at that time, but at that time that was new to me. And then I understood that they have a BSIM Coimbatore group, and that was when I got introduced to the support group. And I also came to know that they had meetings regularly, in-person meetings, physical meetings. So I really wanted to attend those meetings, and the first meeting that I attended, I felt so happy. I felt it was totally, I won't say I didn't learn anything from my medical school. I definitely learned the skill of saving a baby, the skill of saving a life. The credit goes to my professors, to my medical schooling. And then I think I learned most of my pediatric knowledge from my child about how to raise him, and I learned. And the third place that I learned was from this support group. And till date, I've been learning so much from all these parents. And the first meeting itself, the way they interacted, the way they brought out the issues, and see, it's like a peer support group. So when one mother tells you, see, this is what I faced, and the other mother felt much more comfortable. Many times as a doctor, I find it very difficult to convince parents, saying this is normal. But in the support group, what happened is, when another mother tells you, see, I have faced the same issue, my baby has gone through the same phase, now my baby is better. The mother feels much more confident, or the parent feels much more confident. So I was very much impressed with the support group. So I went there, being a learner first, and then I learned, and then I helped them by giving expert talks and spreading the message there. So that's how the journey began. Now see, one very important key thing that I've learned from the support groups is empathy, a quality called as empathy. So I basically still think as medical professionals, we need to develop that. The communicative skills and the empathy is not taught there. Probably there's no time in the curriculum, but or whether that has to come from within, I'm not really sure about that, but that was lacking in me before that. I definitely was not as empathetic as I am right now, and my communication skills have definitely improved because I see parents in real talking about what makes them feel uncomfortable in a doctor's clinic or in a hospital. So rather than getting offended by that, I started accepting that. Maybe if everybody says that they have a problem with that, we should probably find a solution to that. So I started stepping into their shoes, I started becoming more empathetic, and I understood that to be a better doctor or to be a better person, I need to have a better listening skills. So I worked on my listening skills, and that has helped me a lot. I've become a better doctor, hopefully, a better husband, a better parent, a better human being also. So I think that is something which is very important. Being empathetic is is one of the key points that I learned from that. In my practice, I started seeing that parents were much more convinced, and it was easy to convince them. Suppose I wanted a baby with wheezing to be started on inhalers. Prior to this, I used to say, see, your baby has wheezing, start inhalers. The thing would be inhalers addictive, I'll not give this, that, and they'd go to another doctor shopping. They would go to another doctor. They would keep shopping until they get a proper answer or they would go into some other alternative medicine, but things were not working out. Now after me trying to be empathetic, I could answer their questions. I understood what their questions would be, so I addressed their questions, and then the starting inhaler therapy was actually easier for me. Another thing, when I'm a neonatologist, so I admit sick newborns. So when I take care of sick newborns, sometimes we tend to lose them. Some babies die, some extreme preterm babies die. Even after 1 month or 45-50 days in the NICU, we can lose preterm babies. So even breaking bad news was easier for me. The parents accepted that. They saw the efforts that we put in. So though the results were not promising, they were able to accept that. So, but back in my medical school, whenever we break bad news, doctors will be as a group. We were horrified about, we have personally experienced patients beating up doctors, patients breaking up things whenever you break a bad news or whenever you declare a baby dead. That's happened with my co-PGs, that's happened with me. But all these 12 years, I've not had any such episodes, even after breaking bad news. The parents shed tears, I sit with them, I hold their hands, I let them cry, and then things start getting better. So even breaking bad news has become easier after I've become more empathetic. So one platform is the support groups. I think the support groups should grow. We should have more parent support groups, and maybe doctors also should be a part of the support group, the parent support group, not as an expert, as a member itself. So the doctors should be a part, not just parenting, for anything else also. Parenting is one support group. We need more support groups like that for everything. And that is where I think we can probably come down. The doctors also should probably step down, and we should be treated as fellow human beings. It's not like doctor should be looked up as a doctor. We are a fellow human being, and that's how the communication should be. And online or social media is again another very good platform, with Instagram, with Facebook and all that. I think reaching out to the common public, YouTube and all that, reaching out has become much more easier. So I think medical personals and doctors should be more interactive on the social platform as well, in spreading messages and also in interacting with the public. See, first thing is do your research. Okay, there is knowledge everywhere right now with internet. You should know where to get the resources from, but do your part of the research. Again, support groups are one, and there are so many resources available online. So read a lot. That's what I tell parents. Whenever you get time, read a lot about parenting. See, we've been used to something like everything we need a manual. Washing machine, TV, everything we read a manual and then do. Parenting doesn't come with a manual. So, but there are a lot of books that you can read about. So read about it, read about parenting, read about illness. You need not be a medico to understand all these. All these are in layman's language. So understand that, do your bit of research, and pick a proper healthcare professional who would respect your choices. It is not like you go here, do whatever they say. A good doctor should be a good listener, and I always feel that the mother's instinct is always right. Whenever I just dismiss a concern saying this child is okay, and if the mother tells me, no doctor, this child is sick, something is happening, I immediately make the child sit for half an hour, 1 hour, observe and then say. And even in my front office, this quarrel always happens. They wait for a long time for a appointment, 1 hour, 1.5 hours. The mother tells the front office receptionist saying, the child is really sick, I want to see the doctor immediately. The front office people keep saying, no, there are patients ahead of you, wait. And within 5 or 10 minutes, the child might throw a fit or the child might collapse. This has happened many number of times. So I've told all my front office people, respect the mother's instinct. Mother is always right. If mother says something is wrong, there is something wrong. So in case you feel, the mother or the parent, the caregiver feels something is wrong with your baby, please speak out to the doctor. If the doctor is not listening to you, change the doctor. It's as simple as that. You have all the rights. It's your child. The child cannot speak, so you are speaking on behalf of the child. So you need to talk your heart out. You need to talk what you feel. Don't feel, and there's nothing called as a silly question. No question is silly. Not asking a question is what is silly. So please ask something, whatever you feel, anything that is crazy, even if it is crazy, you're just talking to a fellow human being. That person, hopefully that person should be a non-judgmental person. That person, the doctor is not going to judge you. They're going to take your question as a question and answer you. In case you're not satisfied, search for another person. So you have to probably be bold, do your research and speak out your instincts. No, see, sex ed is really important, and sex education is the right of every individual. So every individual needs to know about their own body. It's your right. And who teaches that? I think it should be the parent. We should not wait for the internet or children figuring it out through peers, because that's always going to be incorrect. So I think as parents, we need to impart sex education quite early. That is going to play a major role in gender identity, sexuality, and lot of other things, going to prevent child sexual abuse. The child should know about safe and unsafe touch. The child should know that the child can control their own body. They have the right to say no, and also respecting another human being, respecting no's from others, sexuality, gender identity, all this should be initiated early. And sex education, as I told you, is the right of every human being. See, again with birth, see, olden days what happened was each mother used to give multiple births, and so it was different. Now with one or single child, I think every pregnancy is becoming more and more precious, and it's becoming more and more hospitalized also. It's not becoming that natural as it is supposed to be. So with birth education, again, what we say is birthing is a right of every woman, and she has the right to choose how she wants it to be. So it is not necessary that you should always go by the books and just go as it is. You have to plan it, and you have to do your research on it. When do you want the baby? Do you want the baby at all? How many baby you want? It's finally the parent who decides. Do not do it for the society. That's what I keep telling, because finally it might be you and the baby who's suffering at the end. So be prepared. And then there are numerous options. There are numerous options. There are birthing centers right now. There are so many natural birthing centers. So do your research, see what you're comfortable with, and there is VBAC, vaginal birth after cesarean. There are so many other options. So do your research, talk to your healthcare provider, and tell your healthcare provider what you want. You have the rights to do that. Okay. Like, see, for example, right now the medical curriculum recommends, the WHO recommends delayed clamping of the cord. That means the umbilical cord. After the baby is born, we 10 years back when I was studying in my medical college, we used to clamp the cord immediately, cut the cord, take the baby to the pediatrician side, and do the resuscitative measures for the baby, even if the baby is vigorously crying. Okay, but the placenta contains almost 100 or 150 ml of blood, and whose blood is this? This is the baby's blood. And what are we going to do with that blood? We're just going to throw it into the trash. So research actually now says, and WHO also recommends, you delay the cord clamping for almost 1 to 3 minutes. And this was what in olden days our grannies used to do. They used to wait for the umbilical cord pulsation to stop. And there's something called as a lotus delivery, where you wait for the placenta to come out, and only then you probably separate the cord. Until then, the baby and the placenta and the cord are a unit. They are together. So right now all hospitals are supposed to practice delayed cord clamping. That is very, very essential, especially more so for a preterm baby. Though this is the norm, there are not many hospitals practicing this, because some doctors, again, see, doctors are again human beings. They cannot keep up with the day-to-day updates, read every day, and also attend to their clinic and their family. So not every doctor might be fully updated. So it's your right to probably ask or tell the doctor that, see, I need a delayed cord clamping. I need immediate skin-to-skin care with my newborn. I need to breastfeed my baby immediately after birth. Even if it is a cesarean or whatever it is, I need to do this immediately. And the decision, you need not argue with the healthcare provider. Tell your views. And if it is scientifically safe for you, then probably go ahead. If VBAC you feel scientifically safe, your healthcare provider also feels it's scientifically safe, please go ahead. And demand for certain things like skin to skin, immediate breastfeeding, and delayed cord clamping. These are 3 things that as a pediatrician, I would say a parent needs to be completely educated about during birth. So obstetric point of view, there are many more with no interventions. As a pediatrician, neonatologist, these are 3 things that I would definitely emphasize: delayed cord clamping, immediate skin to skin care, and immediate breastfeeding. Yeah, it is happening, though not completely there. It is definitely happening. Definitely doctors are becoming more empathetic. There are a lot of doctors who are empathetic. The doctor-patient relationship is becoming much more better, I would say. And I think as a pediatrician, I personally feel that the concept of family doctor is slowly coming back through a pediatrician. Because right now what I have seen is kids who were small, their family, their parents, everybody, any health concern they have, they ask us. And then we refer them to the specialist, whoever should be. That general family doctor concept is slowly coming in. I think that is a good thing. Otherwise, only specialist for everything might not be a good trend, was not a good trend is what I feel. We need specialists, but we need in-between person to bridge the gap. And I think we need a family doctor perspective, and that is slowly coming back. And the patients are also developing more trust in doctors these days. And one very good thing is patients are reading a lot. That is something thanks to the social media. Parents are becoming more educative, more informative, and they are doing their bit of research. So which is a very good sign. Yeah, so see, integrative medicine is the need of the hour. Like, we have ancient medicine, we have ancient practices, we have a lot of good practices in that. But as you said, it's all not documented. But there is experience available. There are a lot of anecdotes and stories and experiences available. We need to work on that, and we need to integrate that in the mainstream hospital or mainstream healthcare. That is happening, at least in Tamil Nadu and in India. We have the Ayush program, where the government itself recommends it's not just allopathy. You have Ayurveda, you have Unani, you have Siddha, you have Homeo. Everything is integrated, all for the wellness of the individual. Similarly, even in birth care, you have midwives, you have doulas, you have so many other people who have a lot of knowledge within them. So I think the integration needs to happen. And that is happening now because for our medical conferences, at least for obstetric and neonatal conferences, midwives are being invited as speakers. So we are getting to learn things from them. And that again is a good trend. It's not happening everywhere, but at least it's the beginning.